You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, and I'm coming to you today with another message of hope, health, and wholeness. And if you need that in your life, I encourage you, pick up the phone right now and dial our number, 531-289-7100. And you can speak with me. You can leave a message. You can send a text even. Send an email to me at drjake@goodlifefamilychiropractic.com, and I'll get back with you because I'm here to answer your questions. I actually had a fantastic patient today, a listener, a radio listener. Huge shout out goes to Steve and Sue, just longtime listeners, huge fans. And I got to go over Steve's x-rays today and just kind of showed him some of the issues that were going on with him. And I made a comment following the review of the x-ray. And I said, Steve, if we leave this problem here, I wouldn't be surprised. And I'd definitely be concerned if we start seeing some issues with urinary continence. And that really just caught him off guard for a second because he had been dealing with some urinary distress symptoms over the last year, but nothing he had ever done or looked at his spine as a potential cause for that. And that just, in a lot of ways, it blows me away, not from his perspective, because none of us are taught to think about this. It blows me away from the medical perspective because we're all taught. Every last medical professional is taught first day of anatomy and physiology that the central nervous system is the most important system of the body, that it controls all function of every organ, cell, and tissue. And shouldn't it be obvious to us as medical professionals when we're presented with a symptom that we should address the cause and work our way backwards and start with maybe the most important signal, going out and controlling that, examining the spine, especially when someone has a history of low back injury. And they just missed it completely. They missed it completely. And nobody knew to tell him to look to his spine for the cause of his symptoms and his dysfunction, and ultimately what's leading into disease. And so that's not what I want for you. And if you're dealing right now with similar issues, if you've got prostate issues, if you've got bladder issues, if you've got kidney issues, and it's causing urinary symptoms, and you haven't checked your spine out to see if that's contributing to the issue, then we have to start there. 531-289-7100 to set up an appointment to sit down and do what we need to do to figure out if your spine's involved in this. And some of you might be sitting there and thinking to yourselves, what does the spine have to do with the nervous system? Well, if you're following along on Facebook, and you can follow along every single day with our videos on Facebook, I have a diagram up here of the spine. We're doing this on video, but facebook.com/AskDrJake. And you can see off to my side here that we're actually looking at the spine from the front and from the sides. And from the front, it should be straight up and down. And from the sides, it should be 345 degrees. And in that position, there can be no pressure or damage on your central nervous system. It is perfectly protected by the hardest substance in the body. You literally have to break bone in order to get through, to get to the nervous system. But if that's out of alignment, even 2 millimeters or 2 degrees, that can start to put pressure or damage on your central nervous system, on the brainstem, the spinal cord, the nerve roots, and you start affecting one of those, and you start affecting organs, cells, and tissues at the other end. In fact, we see the connection between your brain and the organs start to decrease. Within 5 minutes of being out of position, a decreased signal by as much as 60% if left there for just 5 minutes or more. And that's just the smallest amount of misalignment. So we need to make sure that we're consistently taking care of this, that this is not stuck out of position, that this is moving properly, and that it maintains the proper alignment. How do you do that? Same way that we took care of Steve and Sue. First off, we start with a history and a consultation. Figure out what your goals for your health are, what your health history is, the things that you're bringing to the table. And then what we need to do moving forward is based off of that exam. So we started off with posture. And in Steve's case, we saw some very significant postural deviations. Posture is the window into the spine. And so what we saw is a high shoulder on one side, a high hip on the same side, and we saw head forward posture. Every inch that your head goes forward from your shoulders adds 10 pounds of stress to the spine. That's not a good thing. Your spine degenerates at a rate of 7% per year. If left there I mean, even just the smallest amount of misalignment. And so we don't want that to degenerate, because degeneration is what turns into arthritis. Arthritis is not an aging thing. It's a misalignment thing left there over time. If you want arthritis, degenerative arthritis in your spine, do nothing for your spine for the rest of your life. If you want to stop arthritis in its tracks, then what we need to do is we need to start with that exam and figure out where the spine's out of alignment so that we can stop it and start working it backwards, addressing the causes of arthritis. So once we get that postural check, once we look to see that everything's in the right place posturally from the outside, then we need to start to see functionally how your spine's moving. And so I check the ranges of motion. Should be able to bring your chin all the way to your chest, head all the way back and up to be able to look back at the ceiling, be able to bring your shoulder or your ear to each shoulder on both sides, be able to bring your head over your shoulder on both sides. And if there's any restriction in that motion, even the smallest percentage, means that your brain's not getting all the energy it needs, that there's not the free flow of cerebrospinal fluid between your brain and your spinal cord. And so we need to make sure that that's moving properly. And then we need to be able to see from there, is there any pain or discomfort or spasm or swelling around some of those joints that we are seeing as being restricted? If it's restricted or swollen, it indicates a problem. If it's painful to the touch, pain is always a sign that there's a problem. Pain is never an indication that you should just wait and see if it goes away. Pain is not the problem. Pain is the signal that God created inside you to tell that there is a problem, that you need to do something about it, that you need to be proactive. And so if you have any amount of pain, especially if it's consistent, then you need to have it looked at, not just to give you a muscle relaxer or a painkiller, but to actually look to see what the cause of that pain is before we start taking those actions. If it's a muscle, hey, maybe you don't want a muscle relaxer. Maybe we want to stretch it out. Maybe we want to work it out. Maybe we want to strengthen the muscles around it. If it's a actual joint issue, we need to see what's creating that joint issue. And worse, if it's a nerve problem, we need to be able to see what to do to address that nerve problem. And that's actually where the fourth step of this comes in. And that's actually the digital nerve scan. The digital nerve scan, it's static surface electromyography, which allows us to see the electrical current as it runs through the nerves out to the cells, tissues, and organs in your body. And if that's impeded at all, the research done on this test actually showed that a severe or even damaged level of nerve flow can actually predict problems developing in the organs within the next 5 years, diagnosable diseases within the organs within 5 years. And that's the strength and power of the nervous system. If it's flowing freely, those organs don't develop disease unless there's a severe toxicity or injury to those tissues. But if there's interference in that nerve pathway, organs start to fail. That's the problem with scoliosis. If you have a scoliosis, it decreases your life expectancy by between 14 and 18 years. But we know how to correct that here. We don't have to wait until it becomes a surgical issue and you end up spending $1 million on trying to correct this problem that the medical community doesn't really have a good idea about how to correct. In our office, we have specific protocols about how to reduce scoliosis safely and effectively. And if you need the help with the scoliosis, call our office, 531-289-7100, and we'll walk you through those protocols and make sure that we're getting you on the right track, get you a new patient exam. Any necessary x-rays would be the next step in that exam process, but you have to call now, 531-289-7100. And if we don't pick up the phone, leave a message so that we can get back with you and get you set up for that exam at the big discount that we're doing. So the x-rays are a huge part of this. It actually shows us not just what the problem is or where it's coming from, but how to correct it. Because if this is a neurological issue, even if it's mostly muscular, we still want to look to see what the muscle is attaching to. The bone, the joints, that has the least amount of flexibility and motion. So if they're stuck out of alignment, the muscles will go haywire. The nerves will go haywire, and the brain will actually go haywire as well. The brain will actually have to start taking guesses as to what your organ cells and tissues are doing on the other end. And so we want to make sure that everything's in proper alignment, moving properly, take that x-ray, see what's going on. So if you look at all the elements of this test, if you think about going to the medical doctor's office, getting this done, and over there, you're going to be spending hundreds, if not thousands of dollars for the test, just depending on what your deductible is. So I don't want that to be an inhibition for you to be able to come and get this test. And so if you call right now, that exam will just be $42, and that includes the x-rays. And just one more thing, for the first 5 callers, if you call right now, we're going to give you a 50% discount off of your first adjustment in our office. If you need an adjustment, the price on that will go from $60 down to $30. Exceptions do apply. So do let me know what your insurance company is so I can tell you if it's going to be the 50% discount or if it's an exception case. But yeah, call now. That's, it's all about finding the cause. And that starts with that exam. So call 531-289-7100, and I'll be happy to walk you through that. I see scoliosis every day. I see people that have been living with scoliosis for years, creating debilitating pain. That's only a grade 1 scoliosis and doesn't take much to correct. Just time and commitment is really the main thing. But some people just aren't ready to get there yet. If you're ready to get there, if you're ready to start to step into the plans and purpose that God has for you, pick up the phone, send me a text, 531-289-7100. I'll get that, and I'll make sure that we get your questions answered and get you going on the right path. You can also send me an email, drjake@goodlifefamilychiropractic.com. And there are those of you that are waiting for the holidays. Please don't wait for the holidays. This is urgent. Nerve issues don't get better with time. They just get worse. And the holidays is the time when we start to see those issues the most. So if you're waiting for the holidays, you could be setting yourself up for failure. You could be setting yourself up for a premature exit or a premature, disability that wouldn't have happened had we taken intervention right now. We've got appointments available all the way up to through Christmas. We're taking the day before and the day of Christmas off to be able to be with our families, but we'll be right back right after that. Monday through Friday, every week with holidays accepted. But we're here to help serve you because I see so many patients do put this off. One of my best examples, unfortunately, was just devastating to me. I was a young doctor in Florida practicing under another doctor, and he sent me out, and I was doing all these events and getting out there, getting to meet people in the community, and doing my spinal screenings where I was scanning people for free in stores and at shows. And I was at this RV show, and I remember meeting John and his wife Hope, and they were walking through, and they were so interested in what we were doing, but they just curiosity. They weren't ready to make an exam or time to consult with me, but they wanted to come hear more. So they came to our dinner. And the dinner went fantastically. They said, okay, let's set up an exam, but we're going to be a little busy over the holiday, so it would be best if we put this off until the new year. And so I said, okay, I'll give you a call after January 1st. We'll get you in. We'll get you started. And so I call him up, and Hope answers John's phone. And John had just had a heart attack. And that's so common this time of year. Heart attacks at an all-time high in the month of December and November. So don't put it off for the holidays. Call now, 531-289-7100. I'll see you guys again tomorrow for another episode of Ask Dr.